Hello everyone, my name is Marcos Gonzalez. I'm with Mr. Starnes BIO137. Professions that I chose was a radiologic technologist and a radiologist. The reason I chose those two is because I'm actively pursuing to be a rad tech right now, so it's a field that interested me. Daily tasks for a rad tech would include getting patients ready for exams and explaining procedures to patients, positioning patients, getting a clear image for the radiologist to make sure not to overexpose patients to radiation and follow all government rules and regulations. Daily tasks for a radiologist would include reading x-rays, CTs, MRIs, any sort of image, going over patient's medical history to help with diagnosis and treatment plans, coming up with a treatment plan, communicating results with patients. The work environment for a rad tech would be a healthcare setting, hospital, surgery center, outpatient clinic, cath lab. The work environment will have a lot of patient communication, working around patients with a lot of different diseases, infections. You'll also work with other departments within the healthcare setting, whether it be like nurses or doctors. The work environment for a radiologist would be probably the same, a healthcare setting, working with in a team environment, working with other parts of the healthcare field. They'll have to have strong decision-making skills, work around a lot of electronic equipment such as computers, x-rays, CT, MRI. They'll also have to work with a lot of patients with a lot of different diseases and infections. The education for a radiologic technologist can be a 2-year program, or they have 2-year or 4-year programs. The 2-year would be an associate's degree, and then the 4-year would obviously be a bachelor's degree. You'd have to complete a radiography program, and then you'll take your boards exam through the ART, and then after you complete that, then you'll have your license to be a radiologic technologist. From there, you can further your education and go to different modalities such as CT, nuke med, MRI, fluoro, and then you can take exams to get those added on to your license. The education for a radiologist is usually a 4-year undergrad or bachelor's degree, and then you'll have to get accepted into medical school. After you get accepted into medical school, you'll do like your 2-3 years of medical school. You'll have to match with a radiology residency, and then after your residency, you can take your boards exam through the American Board of Radiology. All right, salary for radiologic technologists, the average is about $31 an hour or $65,000 a year. Salary for radiologists is going to be an average of $115 an hour or $239,000 annually. The outlook for rad techs, it's increasing at a rate of 6%, projected to have 13,100 jobs opening within the next 10 years. The outlook for radiologists, their projections are increasing at 4%, 1,000 annual projected job openings between the next 10 years. My thoughts in comparison, these are both great fields to be in. They're both growing. They both contribute significantly to patient care, play vital roles in healthcare, driving future innovation. If you're looking for maybe to work in this field and you don't want to do as much schooling, then maybe a rad tech job would be better for you. But if you have more time on your hands and you're wanting to, I guess, further your education and go pretty far with it, then a radiologist would be a good fit for you. All right, thank you for listening.